Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone, hands-on experience 17. As you may know, the inferior wall and specific, the basal, we call it basal inferior or inferobasal segment, has specific anatomic feature. And based on that, this feature can create falsely abnormal wall motion, and differentiated between the normal and abnormal wall motion at that segment in many cases is challenging, and we have to know how we can evaluate that wall, and that's especially basal inferior. Now let's see how, based on your knowledge, can you guess which of those clips that I'm going to show has wall motion abnormality at the basal inferior. Now let's do it. Here we have first two cases. They are different patient, and as you can see, both of them are apical. And which of them is, if any of them, has any basal inferior wall motion abnormality or not? How you can confirm with the accuracy, high accuracy, and what should you do beside of this, whatever your logic and explanation? Can you have do another study or extra study that confirm your finding and support your finding or not? What about these two cases? Is any of them has basal inferior abnormality wall motion or not? And what is your reasoning and how you can get more information and more supportive data just based on the echo, not EKG or blood test, all those stuff, CT scan. What about these two patients? One of them apical 2 and another PZAX. Is that any of them they have any basal inferior segment wall motion abnormality or not? If you can guess and diagnose correctly all those cases, without any doubt, your knowledge and logic and understanding on the wall motion abnormality is perfect, and you cannot miss anything. Now let's go see the explanation for this segment that I called mysterious inferobasal segment.